Hello everyone. Very good to see such a fantastic turnout to what I believe is a most important event. I'm going to try and cover this ground in the next 15 minutes, albeit very quickly, looking at the main elements of Safe System, thinking about what we need to do differently to implement it, and making some suggestions as to some priority steps which I believe are needed nationally. But first, reminding us of some of our road safety performance, some headline results. 1,460 reported road deaths and over 23,500 serious injuries in 2020. Some decreases recently against a flattened 10-year trend, but these have been largely attributed to the pandemic by DFT. Road traffic injury is a continuing lead cause of death for school-aged children and young adults. The value of KSI prevention in Britain is estimated at over £7 billion. And thinking about our international progress, our progress in KSI reduction since 2010 has been amongst the worst in Europe. And the pre-pandemic UK death rate ranking was joint fourth in 2019. All in all, a recurrent, still unacceptable humanitarian and socio-economic cost. And looking at the key system results which influence KSI, we haven't got comprehensive results on these, and we've got much to do to measure, target and monitor progress. But the safety quality of roads and roadsides and of vehicles, safe travel speeds and safe speed limits, driving without impairment or distraction, helmet, restraint use, the efficiency of emergency medical response. And reminding ourselves of some challenging demographic and mobility trends, both current and emerging, an ageing road user population, promotion of cycling and walking at long last, but with higher KSI risks than for protected users, the continuing popularity of the highest KSI risk mode, powered two-wheelers, and then the issue of emerging driverless and connected vehicles, not a short-term panacea, but a long transition path to automation with safety impacts estimated of more than 30 years. And then we see new risks from new forms of electric mobility, for example, e-scooters. Just to remind ourselves of some of the challenges that we've had to face over the last decade. National target setting in England ended, as you know, though continued in the devolved administrations and some other places. Some ambitious goals and targets set for Highways England, though, now national highways. We saw local authority budgets cut with notable reductions in human and financial resource, and we saw the reduction of traffic policing levels. Little central government appetite for important new safety rules and speed management. Adoption of a safe system approach in the 2050 British Road Safety Statement, and again in 2019, very welcome, but no formal national startup programme or capacity build to assist rollout. And for any further information there, just see the Independent Road Safety Management Capacity Review. And Safe System is recommended internationally by all these organisations, not a new concept by any means, conceived over 25 years ago. A synthesis of current knowledge about best practice road safety management and a work in progress in many places, including the UK. Sweden and Norway, the global and European safety leaders, are the most advanced in safe system implementation, and I don't think that's any coincidence. So what is safe system? Well, according to the ITF OECD, the generic term for Vision Zero, towards zero, and sustainable safety approaches. Safe system is both a long-term aspirational goal as well as an intervention strategy, both working towards the eventual elimination of road crash, death and serious injury, supported by interim targets based on KSIs and SPIs. Safe system strategy involves the planning, design, operation and use of the road traffic system, which takes much better account of common human error and known limits to human tolerance. We see in best practice a gradual upgrade of road traffic system through proactive treatments and death and serious injury not being traded off against other objectives. So a long-term transformational approach, not business as usual, and safe, not safer transport. And some people ask, well, why is a long-term zero goal necessary? Well, safe system isn't safe system without a long-term goal. The goal represents an unambiguous aspiration, embracing the public health eradication principle, providing very clear messages for professionals and the community. The goal challenges complacency that our job is nearly done. Interim KSI targets aren't seen as acceptable performance levels, but on a path towards zero. And the goal emphasises that a transformational approach is needed, which won't be achieved overnight, a long-term project. The goal, importantly, influences intervention choice and investment decisions, and we know that some safe system interventions require at least 20 years in cost-benefit analysis. Well, possible. Well, according to the WHO and ITF OECD, virtually all road death and serious injury is preventable based on current knowledge, and I don't think it's too far a stretch of the imagination to think that we can address any other gaps over the next 20, 30 years. The principles of safe system were laid out by ITF and OECD in 2016, though of course were first identified in the Swedish Vision Zero. People make mistakes, no matter how well trained and educated they are about responsible road use. People make common mistakes, many resulting from simple errors of perception or judgment by otherwise compliant users. I think this is an important point. According to the OECD, less than a third of serious road crashes are caused by deliberate offences or risk-taking. And then, of course, the human body has limited physical ability to tolerate crashes before harm occurs. And these two principles are core system design considerations for roads that we travel on, speeds we travel at, and vehicles we travel in. And then we have the other important principles of shared responsibility and the need for strengthening of all parts of the system. And to remind ourselves of the 5 safe system intervention pillars. All these pillars have important linkages, and speed is a central design parameter. And just to illustrate that, when we think of a restrained driver in the best designed Euro NCAP 5-star vehicle, the threshold for harm, for death and serious injury in head-on crashes is about 45 to 50 miles per hour. For single vehicle runoffs in a similar vehicle, 40 to 50 kilometers per hour. Only 30 miles an hour for junction crashes, and 30 kilometers per hour for pedestrians and cyclists in car crashes. We know that the legal speeds of many roads are higher than the protection afforded from roads, roadsides and vehicles. And legal speeds need to take account of the level of network and vehicle protection available. High protection allows higher speeds, lower protection requires lower speeds. So running through some of the things that are different, well, of course, leadership is a critical success factor, supported by the technical sector and coordinated partnerships. Strong leadership and political will, visible leadership from government, both central and local, professionals and employers. Setting ambitious goals and targets and measuring to manage. The importance of operational targets using validated evaluation tools such as Euro NCAP or IRAP. Tighter coordination to achieve meaningful shared responsibility and aligning with other sectors such as health and environment to achieve co-benefits and build very good business cases. Implementing key legislation and new solutions. Providing new and substantial increased ring-fenced funding. Funding safe system R&D and knowledge transfer. a robust and ambitious national safety performance framework, a much sharper focus on preventing or mitigating KSI outcomes, toleration of minor injuries in a safe system approach, explicit statement of a long-term zero harm goal supported by ambitious interim KSI targets, and measuring specific underlying operational conditions, which I mentioned previously, which influence KSI, setting system-wide SPIs, and at best, as in Norway and Sweden, setting SPI targets in support of KSI targets to actually drive multi-sectoral activity rather than being added on after a strategy is devised. And I think if you look at post-2020, Norwegian, Swedish, New Zealand, Australian and Irish road safety strategies and action plans, you'll see some good examples of this kind of thing. And I've cited here an example from the new Irish Road Safety Vision Zero strategy, setting out 15 ambitious KSI-related system-wide SPIs to 2030. Some very interesting road network SPIs for self-explaining and forgiving roadsides, speed limits which are safe and credible, which I'm sure Susie will go on to talk about later. Some interesting in-vehicle SPIs, overridable ISA, autonomous emergency braking to prevent collisions with pedestrians and cyclists, the traditional compliance SPIs, as well as driving without alcohol, without other drugs, and without fatigue. I'm just running through quickly some of the things that are different. Safe system in the planning, design, operation of the network. Well, countries starting out in safe system, the first thing they do is look at upgrading the national road speed limit classification to meet safe system principles, better matching the protection offered with the speed limit chosen. And Sweden and Norway and the Netherlands provide very good illustrations here. Moving to proactive assessment of KSI risk using the IRAP tool and implementing proactive treatments. Presenting national guidance documents to place safe system in the mainstream of planning, design, asset management. There are plenty of international examples here, and we haven't got very far with this. Substantially increasing ring-fenced funding for targeted safe system intervention. And Sweden, Norway, Netherlands, and Victoria have all put very large sums of investment into safety engineering. And the experience shows that safe system interventions are affordable, many coming from maintenance budgets, and according to the Swedish Transport Administration, providing a better use of public resource than traditional approaches. And of course, then carrying out safe system demonstration projects to build capacity. The safety quality of new vehicles, adopting a national fast tracking of the EU GSR PSR vehicle safety package, a most important set of interventions with greater benefits than from seatbelts. We need to be lobbying here very hard as a profession for the UK take-up of this passage, which is by no means certain. Targeting and promoting improved take-up of Euro NCAP 5-star in vehicle fleets. Both in central government and in local government, and regulating the safe path to driverless vehicles and electromobility. Increasing levels of safe road use, driving standards, graduated driver licensing, combined police enforcement and publicity, in-vehicle driver assistance, very, very important, as is the importance of evidence-based approaches. And then increasing efficient, effective post-crash care, road traffic injury being the leading cause of major trauma. This strategy is critical to a safe system approach, needing continuous improvement in all these elements. There's some recommended priority steps for DFT. Establish a national safe system task force of safe system national and international experts to advise on building capacity, safe system implementation mechanisms, and a startup programme. Prepare a robust, state-of-the-art national road safety performance framework. Review the road classification system against safe system principles. review international and other country guidance on best practice safe system implementation, substantially increase and target investment initially on higher KSI risk sections of the network and junctions through a ring-fence safe system fund, adopt the GSR vehicle safety package that I mentioned, prepare to introduce GDL, lower the BAC limit, the current limit being a national scandal, and ensure that the next road safety strategy is a best practice safe system strategy. So to finish up, death and serious injury by no means the inevitable price of mobility. Safe, not partially safe, is a highly ambitious goal with new challenges for us all. Safe system is being carried out to good effect in several countries and jurisdictions. It is being done. And while a start has been made in the UK, safe system is still poorly understood, and we're at least a decade behind the efforts of other countries. I believe that the time is now right for government and professionals to absolutely, fully grasp safe system and ensure that the new road safety strategy allows us to address its challenge. Thank you very much.